We treat many patients at St. Joseph Medical Center by repairing their mitral valves. We prefer to repair the mitral valve instead of replace it when we can, because that way you allow patients to keep their natural valve, their natural tissue. There's much less artificial tissue in there. And we think that's better for the heart and better overall for the function of the valve. Not every valve can be repaired, but there's a high percentage of valves that can. And the approach that we take is a very widely applied approach where we don't resect any of the native valve leaflet unless we absolutely have to. And what we do is we take the native leaflets of the mitral valve, there's two of them, and if they're not lining up in the right position, we just buttress them with something called an artificial cord, which is a Gore-Tex cord, and we put that right next to the natural cord so that that's able to resuspend the leaflets at exactly the right height, and it makes that valve competent again. That's something that we were able to apply to many of the patients who have leaky mitral valves, and it puts them back on a course to have a normal lifespan and also a much better quality of life.